Hello, and welcome to another episode of Healthy Perspectives. My name is Vernon Solomon. 90% of the information learned and processed by the human brain is transmitted through the eyes. Yet, most people do not get their eyes examined by a doctor on a regular basis. This lack of regular eye examinations possesses a serious health risk because, like several other diseases, eye disease can be silent for many years. A perfect example of this is glaucoma. Glaucoma occurs when there is a buildup of pressure called intraocular pressure within the eye itself. When someone has been diagnosed with the disease, what the doctor is really saying to the individual is that his or her optic nerve has been damaged. The optic nerve is responsible for transmitting information from the eyes to the brain for the interpretation of images in our environment. Damage to the optic nerve is often partial and gradual. Only a small number of optic nerve fibers are affected at any time. Because our eyes are constantly moving around to focus on different spots in the environment, and our clever brains fill in the missing information to produce a clear, meaningful image, an individual can be living with glaucoma and not even know it. Hence, it's characterized as being a silent disease. Today on Healthy Perspectives, we will dive further into the topic of glaucoma. We welcome back optometrist Dr. Julia Bird, exploring the latest technologies available to assist those living with the disease.
I'm Dr. Rick Millis, medical physiologist at the American University of Antigua College of Medicine. We have heard that glaucoma is a devastating eye disease. And today we have with us Dr. Julia Bird, a renowned optometrist who is very interested in preventing glaucoma and has created some organization that is patient-centered and very unique. Welcome, Dr. Bird, and can you tell us a little bit about your organization?
Thank you for having me. Glaucoma is a problem in this part of the world. It's a global public health dilemma, but more so in the Caribbean, where our numbers top many of other parts of the world. And in 2007, we realized that information and education of patients, the patient-centered approach, bringing the patients onto the management team for chronic lifestyle-type diseases like glaucoma was absent and necessary. So we formed the Antigua and Barbuda Glaucoma Support Group, which is really a group that helps patients understand, support them, help them understand that they're not alone in this. And that led to my joining later an umbrella organization, which is called the WGPA, the World Glaucoma Patient Association, which they've encouraged me to become the president of just because of my enthusiasm in the Antigua arena and in the wider Caribbean also.
Tell me, what are the statistics on glaucoma here?
We extrapolate the statistics from a study done in Barbados in the 1990s called the Barbados Eye Study, or group of studies. And because no formal population study has been done here as yet. And their numbers show staggering statistics, staggering prevalence rates of 1 in 14 over the age of 40, and which increases as the population ages. And so by the time you get to the over 70s, it's actually 1 in 6. Now, those are high numbers for disease statistics, as you would know. So you can generalize and say we basically have a 10% prevalence rate of glaucoma in the over 40 population.
I see, that's very high. Now, I'm 70 and I just had an eye examination. The doctor told me my eyesight was 20/20 and my intraocular pressure, which I remember in years past, that's the main measure of whether or not someone had glaucoma, was normal. So it sounds like I'm not at risk at all for having glaucoma. Is that true?
That's not as clear as you would think.
Oh.
The two parameters that you had measured were good. Your eye pressure was normal. You can still have glaucoma with a normal eye pressure. And that's the message that we're trying to get out to global populations, that eye pressure, even though it is still the only modifiable risk factor that we have, measurable, modifiable, we still treat intraocular pressure with medication, but people have to understand that you can still have active disease processes going on with normal eye pressures.
So how do we determine whether someone has glaucoma in the absence of a intraocular pressure measurement?
Well, there's a whole battery of tests, and one of those was you also had normal, which is your visual acuity, your ability to read that letter chart that everybody thinks constitutes an eye test. You have to have your peripheral vision checked, because glaucoma damages the optic nerve in a peculiar and very predictable fashion, damaging the nerve fibers that function for side vision before anything else. So you have to have your side or peripheral vision tested with sophisticated electronic equipment now called a perimeter. So it's called perimetry or visual field testing.
I see. Well, I know in the visual field I have some sort of blind spot. In fact, we all have a blind spot in our visual field, yes. And our brain kind of fills in that blind spot so we don't recognize it. Do people with glaucoma have a normal blind spot, or do they have more than one blind spot?
And that's the hallmark of the disease, actually, is the development of other blind spots other than what we call the normal blind spot. Unfortunately, the brain is very smart, and the brain fills in those blank spots. And an interesting study was recently done asking patients to identify pictures on a wall of what their vision looks like. And the traditional tunnel vision that we describe in textbooks, patients didn't choose that. The traditional black splotches in your vision, patients didn't choose that. Patients are not experiencing black spots in their vision with glaucoma. They're rather blank and missing areas that the brain works very, very hard all day long to fill in.
So are they at risk for falls and having some adverse consequences from that?
Yeah, falls are the hallmark of advanced glaucoma. And a lot of people feel that this trip over cracks in the road or the missing pothole on Old Parham Road because of something else. They don't even attribute it to their vision. And so we're going to great lengths to educate patients and teach them about their visual field losses and show them how to get around that.
So is that kind of a unique aspect of the treatment today?
Yes. This is very new.
Counseling, perhaps?
Yes, very counseling, education, mobility and orientation treatment. Still very lacking. We're still focusing way too much on the surgical aspects and the medication, and we need to treat coping skills. Glaucoma is a chronic disorder. You're going to have it your entire life, no matter the medicine or the science, and so you need to be taught coping skills.
So it sounds like a patient can, once they understand their disease better, can actually overcome some of these extra blind spots in their visual field, and it may help them deal with everyday living.
Very much so. Very, very much so.
We've been speaking with Dr. Julia Bird, optometrist in Antigua and Barbuda and advocate for prevention of glaucoma, one of the most devastating eye diseases leading to blindness. Thank you again, Dr. Bird.
Thank you.
My first cataract I developed when I was 29, which is generally very young for a cataract. So I went to a specialist in England, and he did the surgery, and I was up walking around the next day. So I went back and had what is called an extraocular implant. It was after that second operation that I was diagnosed with glaucoma in that eye. A few more years later, they diagnosed glaucoma in the left eye. I said, okay, instead of putting one drop in one eye, I'll put one drop in two eyes. No problem. The glaucoma has not changed the price of cocoa at all. It's still the same. and I have to use drops twice a day in my eyes for the rest of my life. And once I can do that, it's kept under control. I go and have it checked at least once a year, sometimes more. If I'm having a problem with glare or anything else, I'll go down and let Dr. Bird check it out and see, and add some more drops to the regime, and that's about it. The main challenge that I've had with my eyes is, and glaucoma in particular, is glare. In bright sunlight, I have to wear my hide facers so that it cuts down the glare, and apart from that, my glasses are tinted, and basically is to try and cut out the glare and reduce the amount of glary areas that I have to be in. And of course, I work in the sunlight. I do not think there's anything that I cannot do as a result of glaucoma. Nothing that I know of. The doctors might tell me something else, but currently, nope. Blindness is not inevitable. Once again, once you take your drops, it's controllable, providing it's been diagnosed early enough. If you don't go to the doctor, which a lot of people don't like doing, it's not a painful procedure. It feels like they're just looking in your eye, and they take the pressure, and they can tell you whether you have it, you don't have it, or otherwise. Check your eyes at least once a year, if not more. If you have it, you're supposed to do it more than once a year. If you've just found out that you have glaucoma, all you have to do is take your drops. It's a very easy, simple procedure. You just learn to put in the drops. So I know some people have difficulty dropping things in their eyes, but you just look the other way and put the drop in the corner of your eye, and that's it.
Did you know that if you or someone you may know suffers from symptoms of asthma, they should seek medical assistance as soon as possible? There are many ways to seek help, including Mount St. John's Medical Hospital here in Antigua, which performs diagnostic testing for asthma for adults and children. If testing confirms asthma, follow-up care and personalized education on medicine use can be done by a private physician. Due to the high prevalence rate of residents suffering from asthma, the Medical Benefit Scheme here in Antigua supplies medication for patients free of charge. This medication can include drugs for use in home nebulizers, peak flow meters for measurement of breathing, inhalers, and more. This message was brought to you by the American University of Antigua College of Medicine Asthma League.
Our eyes allow us to experience the world in ways our other senses can't compare to. Let's take care of them. Early detection is key to saving sight. Begin by getting regular eye exams to detect glaucoma in early stages so that your eye doctor can prescribe vision-preserving treatments as soon as possible. All adults and children over the age of 3 years should get a baseline eye exam from an ophthalmologist or optometrist when early signs of disease and vision changes may be detected before symptoms occur. Glaucoma treatments include medicines, laser trabeculoplasty, conventional surgery, or a combination of any of these. While these treatments may save remaining vision, they do not improve sight that has already been lost from glaucoma. Medicines in the form of eye drops or pills are most common early treatments for glaucoma. Taken regularly, these eye drops lower eye pressure. Some medicines cause the eye to make less fluid. Others lower pressure by helping fluid drain from the eye. Laser trabeculoplasty helps fluid drain out of the eye. Your doctor may suggest this step at any time. In many cases, you will need to keep taking glaucoma medicines after this procedure. Conventional surgery makes a new opening for the fluid to leave the eye. Your doctor may suggest this treatment at any time as well. Conventional surgery is often done after medicines and laser surgery have failed to control pressure. For more information on glaucoma, you can visit the Antigua and Barbuda Glaucoma Support Facebook page, the World Glaucoma Patient Assistant Facebook page, and or www.glaucoma.net. Take care of yourselves. We thank you for spending some time with us and for allowing us to share healthy perspectives with you. Be well, Antigua and Barbuda, and may your perspective always be a healthy one.